Hi, this video is the FUE hair transplant restoration surgery on a patient who had an FUE done to fill in both corners and his hair, lower his hairline. And before we go further, I want to show you what his picture looked like before, how bald he was. And that was him. And this is what he looked right now. And it's very dense and natural. And we built his hairline according for his facial structure and for his ethnicity, and I'll build it for each individual. And hair transplant and hairline is an art form. You want to make sure that you have the hairline is very natural and dense, and it requires a lot of aesthetic and artistic detail for a natural result. This is what it looks like on the right side view and left side view, and that's what he looks like right now. And I just want to comb through it and show you. And it has excellent density. There's no way you can leave your hair short if you don't have good density. People can see through it. So you see how it's nice. And the first requirement when doing the consultation, and he reminded me, is that I want you to leave my hair short. So can you make sure that the result will be dense enough that I can wear my hair short? And the answer was yes. And the other one is he does not want to leave any scar in the back of the head. So we opt for the FUE method. We did around 1,500 grafts. We fill in from the front, not just both corners, but work throughout like this. And for the audience who want to know more of my work, go on my YouTube channel, JG Diep, or my website, www.mhta.clinic.com, or 1-866-999-6482. And you know, I am one of the hair transplant surgeons who specialize in the art of ethnic hairline. So I create the hairline not only depend on each individual ethnicity, but individual facial structure. I create the hairline for Caucasian, for Asian, for African American, for Hispanic, for all Middle Eastern. All of them have their own hairline, and it's different. And each individual facial structure, they have different hairline too. And the important factor is from the eyebrows and up is 6.5 to 7 centimeters for Asian and African American. For Caucasian is from the eyebrows and up is 7.5 to 8.5, and somewhere in between is the Hispanic and Middle Eastern and other ethnicity from 7 to 7.5. So that's on average for each ethnicity, but you cannot base on just average, because some people, if they have longer face, so then the hairline got to be a little bit higher. Some people have a shorter face, the hairline got to be a little bit shorter, just to make sure that it's even. Another rule of thumb is to break your face into a third and a third, from the hairline to the eyebrows, from the eyebrow to the tip of the nose, to the bottom of the chin. It's around a third and a third. Look at Mona Lisa, the picture, her overall facial structure. She breaks it. If you do the measurement, it's around a third and a third and a third. And I emphasize a lot in the artistic size, because you know why? You do not want to mess up when you have a hairline and hair transplant. There's some clinic they might really say it's cheaper, especially the FUE. They talk about neograft. Well, guess what? Some of the neograft is not the surgeon who designed your hairline. So it's the hair tech does it. So they can do the hairline very low or very high. So you know there's a big difference between when the hair tech does the whole surgery or the surgeon does the whole surgery. I mean, you might save $1,000 or a couple $100, but overall you spend thousands of dollars. If you know, for me, if I get sick, I want the surgeon to operate on me. For aesthetically, for cosmetically, I'm not gonna cut corner and have a technician does all the surgery. I want the surgeon to do it. And as you know, you look at the overall price of the FUE. If you go choose the wrong place and have the technician does everything, it will cost you more in the long run. Why? Now, after that, the result won't be dense and the hairline is all messed up. You will not only suffer through financially, spending more money and come for me to fix, but emotionally you got to go through all that stuff. So it's best to choose a surgeon, the right clinic, the first time around. And if the surgeon talk a lot about the hairline, talk about the appropriate of the facial structure and the hairline and the before and after, you got to see not just the hairline got to be appropriate, but you got to see how dense the result is, and that really tell you how good the work is. So for this patient, we found out it's around 6.5 to 7 centimeter, and then we because his face is not super narrow, but not round either, so he has a curve, arch back. The more narrow the face, the more arch back it is. The more round the face, the more flat the hairline is. And you can see the hairline is zigzag, it's never straight, so it goes up and down, up and down, and up and down, and that's how it's natural that way. And he even mentioned to me, no one know he had it done. Maybe the first month he wears a hat, but after that he didn't wear anything, and all the colleagues he works with, no one knew he got it done. Why? When the hair grows out, it grows very slow and subtle. Your look would change. By the 4 months, you know, when the hair begins to grow, it grows very slow. I mean, have you ever seen watch your hair grow? You can't. And that's the same thing about this patient. He's starting to grow very slowly, and it grows out full density, very good density for him. And the angle is very appropriate. 35, 45, increase when you go backward and change when you go different direction. So this is before and after hair transplant. Just to show the audience again what he's looked like before and after. And this is what I look like right now. Very excellent natural result. And thank you for paying attention. And if you want to know more about his work, he blogs about this. This patient, you can even contact him. His title is Can You Hear Me Now? On a lot of forum and all this stuff. This patient, just to give you a disclaimer, he does not work for me. He does this just to show the audience to review the audience how his experience like, what he went through, and how he came about to find me. And he doesn't want other people to make a mistake and just choose the clinic that just over advertise and you hear it all the time. You have to take the time when you choose a surgeon. You want to make sure the results are natural and dense. And if the surgeon really specializes in the art of FUE, FUE is the way to go if you have a chance. Now, if you have really massive hair loss like class 6, 7, go with a strip. Otherwise, you can go with the FUE if you have a mild hair loss. Or mild to moderate, class 3 or 4. Now, if you have a lot of money and you want to do multiple FUE, it can be done, even though you have severe hair loss. But it's cheaper to do the strip if you have very advanced hair loss, like class 6, 7. Class 3 or 4 or less, you can do the FUE. Thank you.